Good afternoon, Mrs. Bello. How are you feeling?
I I don't know. The nurse said you'd explain something about my baby. She said ambiguous genitalia.
Yes, and thank you for your calmness. Your baby was born with differences in sex characteristics called intersex. Intersex is an innate variation in sex characteristics that doesn't fit the typical definition of male body or female body. These variations may be apparent at birth, visible during puberty, or remain unnoticed throughout life. Intersex is an innate biological variation, and it is different from a person's gender identity or sexual orientation. This is more common than people realize. Following United Nations data, about 2% of the world population is born intersex.
What does this mean for my child? Are they okay?
Yes, your baby is healthy. Let me share some context. A recent research report, Medical Practices and Experiences Surrounding Intersex Births in Nigerian Hospitals, by an organization in Nigeria called Intersex Nigeria, found that 85% of healthcare professionals across 50 tertiary hospitals in Nigeria have seen at least one intersex case in the last 5 years. So you are not alone.
So, what happens now? Surgery?
That's a common question, and it is one we approach with care. In the past, many intersex babies have gone through early surgeries like genital reconstruction, hormonal therapy, sometimes without fully understanding the long-term consequences. In fact, that study I was telling you about showed that 33.8% of interventions were done on children between ages 0 to 4, often without the parents' informed consent.
So, are you saying we should wait?
Exactly my point. That same report urges that non-essential surgery should be delayed until the child is old enough, adult consenting age, to participate in the decision-making process. We've learned that majority, at least 52.9% of intersex people face stigmatization, and another 21.4% suffer sexual dysfunction after early interventions like these surgeries. Consent and autonomy matter deeply here.
Your baby deserves the right to grow and choose, just like anyone else.
So, can my child access intersex-focused care in this hospital?
Unfortunately, only 23.6% of hospitals among the 50 sampled hospitals from Intersex Nigeria's research report on medical practices and experiences surrounding intersex births in Nigerian hospitals have knowledge on intersex care, diagnosis, and can provide further investigation with children that present variations in their sex characteristics. But today, we are choosing a more ethical path.
Thank you. I want to understand everything. I want my baby to grow up knowing they were respected and recognized as they are. Hello everyone. I'm here not just as a new mother, but to share a story I never expected to tell. A week ago, I gave birth to a beautiful baby with intersex traits.
Intersex? You mean your baby has both male and female private parts?
Not exactly. Born with intersex traits means their sex characteristics don't fit neatly into male or female sex. It's a natural variation, like people with left-handedness.
So what did you do?
I asked questions. I learned from doctors that congenital adrenal hyperplasia (CAH) is one of common intersex variation. The doctor mentioned that a recent report from an organization called Intersex Nigeria reported that CAH with 56.2% as most frequent intersex diagnosis, while androgen insensitivity syndrome with 34.8% as second most diagnosed intersex traits from the sampled hospitals. She mentioned the report is available in both English and French on www.intersexnigeria.org.
So, Mrs. Bello, is it dangerous to have an intersex child?
Not at all. What is dangerous is rushing into unnecessary irreversible surgeries or hormonal therapy that forces the children into a sex category that enforces a binary gender role. Did you know 70.6% of surgeries on intersex babies were based only on parental consent? And many doctors don't follow specific standardized healthcare protocols in caring for intersex children and adults because they are known existent. Only 23.6% of the entire hospitals reached on this research have knowledge attending to these variations. These irreversible surgeries lead to severe medical complications including chronic pain, scarring, physical trauma, loss of sensitivity, and possible continuous painful surgeries.
What about the child's future?
That's exactly why we must protect their right to choose. Most intersex adults suffer depression, trauma, or shame because choices were made for them, not with them. We have to do better. This is about human rights, access to healthcare, upholding bodily autonomy, and the integrity of intersex people, including children.
Thank you, Mrs. Bello. Your story helps shift our approach from secrecy to dignity, from fear to understanding.
I just want every mother to know there is no shame. My baby is whole, and your child will be too, no matter how they come into this world.
Intersex Nigeria's report, Medical Practices and Experiences Surrounding Intersex Birth in Nigerian Hospitals, examines awareness, clinical practices and interventions across 50 tertiary hospitals in the 6 geopolitical zones. Using mixed methods, it documents how intersex variations are identified, the range of medical responses, and the social and ethical forces shaping treatment decisions, especially non-consensual cosmetic surgeries, often referred to as intersex genital mutilation (IGM). The findings reveal uneven clinical knowledge, inconsistent referral pathways, limited psychosocial support, and patterns of irreversible interventions carried out without the informed consent of the person concerned. The report calls for rights-based standards that affirm bodily integrity, delay non-urgent medical procedures until the individual can decide, and provide comprehensive, inclusive-centered care. It is an advocacy tool to challenge harmful practices, correct misconception. Intersex is not a taboo, curse, or karma. Intersex is not a medical problem. It is a human reality. Intersex people deserve equal dignity, protection, and access to healthcare in Nigeria.
Up to date on intersex issues, visit www.intersexnigeria.org, email info@intersexnigeria.org. Follow us on Facebook, Instagram, and LinkedIn at Intersex Nigeria. Support intersex rights, speak up, help end medical harm. We can build a better and safer Nigeria for all of us.